event organised by the Australian Prevention Partnership Centre. My name is Alexandra Jones. I'm the program lead of the Food Governance Program at the George Institute for Global Health, and I'm taking over the chair of this community of practice this year for Maddie Heenan from our institute, who you'll be pleased to know is enjoying time off with her second child at the moment. So this year's stepping in for her. We have been a little bit quiet this year, but it's great to see so many people turn up for this, which is our first event. Today we're going to be talking about food regulation to promote healthier diets, so actions that are in the food reg system that are about addressing long-term diet-related health. Before we begin, I'd like to acknowledge the traditional owners of the land from which we're all joining today. For me, that's the Bidjigal people of the Eora Nation here in Coogee in Sydney, and pay my respects to elders past, present and emerging. So Damien, maybe I'll get you to bring up the slides. I'd also like to welcome my other speakers today. So I'll be talking a little bit first, just a brief introduction to the food reg system. I realise that many of you may already be working in this system, but for those who don't, we'll just briefly introduce the sort of scope of what we're talking about. I'll talk a little on the health star rating and where that's up to, and then I'll be passing to Damien Magana and my team, who will talk about more of what's happening in food. Then we're also joined by Clare Hughes and Dr. Linda Weller-Cole from Cancer Council New South Wales, who are going to be talking about what's on the agenda in terms of alcohol. Next slide, please, Damien. I've already done that. Thank you. Yes, so the food regulatory system. Before we start talking about all these policy options and what's happening, I thought it would be good to just take a step back and make sure that everyone understands what the food reg system is and sort of situate it within broader policies and prevention policies in Australia, because not everything, for example, that's about long-term diet-related health would go into the food regulatory system. Other things from the National Obesity Strategy may be dealt with by the Department of Health, say, or things in Ministry of Health at a state level, but we also have this food regulatory system that is particularly suited to addressing some issues. The weird thing about the food reg system from a legal nerd perspective is that it's binational. So we're making policy here for Australia, but also for New Zealand. And the involvement and who makes that policy is actually also a federated thing. So we have, when there's a vote of food ministers, that's a vote of the Australian Commonwealth Government, the New Zealand federal government, and state and territory ministers in Australia. Every jurisdiction gets one vote. So that means that New South Wales has the same amount of votes as New Zealand in this system. And things tend to be a majority vote. And that makes it quite unique. Underneath what happens at this top level with food ministers making policy, we have Food Standards Australia New Zealand, which is FSANZ, which we'll use that probably acronym quite a lot in this presentation. But so as the regulator, with officers in Australia and in New Zealand who are doing a lot of the work to make the food standards and to implement them in Australia and New Zealand. And then we have state level food authorities in many cases who are responsible for enforcing the food standards. And they are enforcing standards around food safety, so they're doing premises inspections, as well as having responsibility to enforce some of these long-term food policies like food labelling requirements. And the other thing to note about the food regulatory system is that under the FSANZ Act, which Damien will also talk about today, this system has particular processes for how evidence comes in, when evidence comes in, and also rules for stakeholder engagement. So how FSANZ has to liaise with the food industry, for example, as well as public health and consumer stakeholders. And so all of these settings in this system have an impact on the policies we're going to be talking about today. Next slide. So I think the good thing about this system is there are a lot of opportunities to push through improved regulations to address long-term diet-related disease. It's a prescribed pathway, and I'll show you a visual representation of that pathway in a coming slide, but there's a pathway there with various steps. We know what they are, and we know what has to happen for a policy to get up. It's also an obvious choice for some particular policies. So, for example, if you want to do something about food labelling, because most of Australia's food labelling requirements come already in this system, it's an obvious place for your policy to get progressed. However, there are also downsides to this system. On the one hand, the fact that there's this prescribed pathway and that it involves all the state and federal governments can be good in that, a political change in one jurisdiction, for example, doesn't necessarily mean that the process changes, because if the other ministers stay consistent, the process continues. However, it's a complex process, it's lengthy, there are different ministers and governments coming and going all the time that can change who the champions for different policies are, and this also creates a lot of opportunities for things to stall. The processes and the evidentiary requirements in the system can also be challenging to navigate. It can be hard to know who has carriage of this right now. Is this with food ministers or is this sitting with FSANZ? Who has to make the next decision? Sometimes it feels like the same issue is being consulted on again and again by different people, and these things can be challenging. So while there are lots of policies that are in here, I would also always ask you to question, is the food regulatory system the most appropriate pathway for your policy aim? So today we're going to be talking about quite a few things that are already in the system, but there might be other things coming up on the agenda where we might question, do we actually want them to go in the food regulatory system? Next slide. These are just two visual sort of representations, obviously very busy, and I guess you do not need to read the content, but all you need to understand is this shows the complexity of the process and the amount of steps in that process and the different stakeholders. And then on the next slide, this is a slide of what's actually already on the FSANZ work plan. So when we're also asking for something to be progressed by FSANZ, we always need to bear in mind that there's already many things on the FSANZ work plan and limited capacity in that agency to progress everything. So, here you can see that a lot of these things aren't about obesity or long-term diet-related disease either. So, there's things there about residue limits, egg standards, all sorts of different things, as well as the things that we may consider a priority, if we're working on obesity. Next slide. So in terms of the first content that we're going to talk about today, one of the obvious ones been in the media a bit again in the last couple of weeks is the Health Star rating system. So this system to date is about 10 years old. It's been sitting outside the system because it's been implemented on a voluntary basis. So ministers have been making decisions about it, except it hasn't been in legislation yet. Now, the Health Star rating is being considered right now of whether it will be mandated. And this figure here just shows the levels of uptake. So there's different sources of data, but you can see they're pretty much consistent, and that Health Star uptake is sitting at just under 40%, regardless of where you get your data source. And this little blue line that's up much higher are the targets that were set by food ministers for the Health Star rating to remain voluntary. And so in November this year, we're going to hit that final target of 70%. Well, the period for that target to be met will clock over, but we're obviously not going to meet that target of 70%, if you can see from this data here. So there's already work in the system underway. Then FSANZ is already doing preparatory work to prepare for the Health Star rating to be mandated when this target is not met. Next slide. This is a sort of our best guess timeline for what mandating the Health Star rating could look like. So you can see here we've already had sort of other targets where the government has reported for the last couple of years that industry has fallen well short of the voluntary target, and that is why food ministers have already started the preparatory work to mandate Health Stars. Once they meet the 2026 target, what we're anticipating is that government would report on that by about March next year. And so they'll report the official government figures. They will also present the results of their preparatory work, which is currently underway. And then they will potentially ask food ministers to make a decision then to mandate and then raise a law, raise a proposal to change the Food Standards Code to make health stars mandatory. We are hopeful that in an ideal world, allowing for consultation and everything, that we may actually get that proposal sort of approved and passed by the end of next year. And then if we allow industry 2 years, which we would say is reasonable, we're looking at a mandatory health star on all products by 2028. But as you can imagine, these sorts of timelines often get negotiated. So it's been a long journey for health stars, but we are entering an acute period of potential action. Next slide. So while it looks like we have a good chance to mandate health stars, there are also other improvements that public health and consumer groups have been asking for, and we are trying to make sure are addressed during this preparatory work. One of the obvious things is around the algorithm for health stars. So while we know that most people do support mandatory health stars, they want to see it mandated. Many people are actually surprised it's not already mandatory. We do have the issue of the algorithm, particularly under a voluntary system, which has meant that companies are predominantly using health stars where their products score well. And they're hiding that information from consumers where they get a low rating. But where it's problematic is where products score well, but consumers think that they shouldn't score that highly. So, you may have the classic example would be like a Nutri-Grain. Ultra processed, pretty sugary cereal that still is able to score 4 stars. So we are asking for the priority to be that health stars is mandated, but sometime soon we're also going to have to work on an algorithm review to make sure that the health star rating algorithm remains up to date with nutrition science. One potential trigger for this could be, for example, the publishing of the Australian Dietary Guidelines update, which is also hopefully anticipated by the end of next year. Other changes to health stars that could be looked at in the preparatory work, here you can see visually, would be adding colour to the logo, and also considering things like ultra processing in the logo. So there are submissions on this. There was a call for information, and we've made public submissions on this, and anyone who's interested in sort of seeing the full scope of potential improvements, I'm welcome. I can point you in direction of that. Next slide. I'm going to hand over to Damien now to talk about our next issue.
Thanks, Ellie, and hello, everyone, and hopefully you can hear me okay. So alongside the health star rating preparatory work that the ZANs are doing, they've also raised another kind of issue being a review into the nutrition information panel on the back of pack. So the ZANs started this work themselves, adding to their already significant workload. I guess this builds on evidence that consumers trust but don't use or don't know how to use that back of pack nutrition information. Our general position to date as a kind of public health and consumer community is that this doesn't really need to happen. Fans don't need to dedicate significant amounts of resources to this just yet. Part of this is, the point of health star ratings is to interpret nutrition information panel, and adding kind of extra information or additional interpretive measures are only likely to confuse people further. And again, there's concerns that this may delay other priority issues. After this consultation earlier this year, this was bundled in with the health star rating call for information. I think most of the responses from the sounds of it didn't see any use in this either, but next steps are really to be confirmed. One of the main things that we are calling for is for added sugar labeling to be put back on the table. This has been on the agenda since the Blewett Review all the way back in 2011. The Australian Dietary Guidelines say that you should be limiting foods with added sugars, but you need to be able to identify them first. So obviously we don't have added sugar labeling on products at the moment. A few products voluntarily declare this, which is nice to see, primarily where it reflects positively, where there's, say, natural sugars from dairy or from fruit. There's been a process over a few years, lots of enthusiasm on the part of the government, and this was initially okayed by FSANZ too, that this kind of work might proceed. But recently, barriers have been kind of newly identified to this progressing, most along the lines of consumers are confused about added sugars labeling in the first place. If we don't have added sugars labeling, then we can't begin to educate people about what they need to avoid in foods. There's also a couple of other technical arguments. I think at this point they're really saying that they need additional evidence, but they may not create this evidence themselves, may not reopen this issue at all. So at the moment, it looks like added sugar labeling is off the cards. We will be seeing what we can do about this. It also needs to consider not just the nutrition information panel, but also ingredients. We know that around the world. See, there's an example here from the United States. Added sugar labeling is available and hasn't been that onerous for business. Another issue that's going through the food regulatory system at the moment is commercial food for infants and young children. There's lots of concerns with the marketing of these products, their texture, their composition, the packaging. Oftentimes these products are pretty unnecessary and they're mostly unhealthy and pretty pricey too. And this kind of covers those foods that have age statements on them or that are really clearly targeted consumption by kids under 4 years of age. It's been a long-standing issue in the food reg system as well, but there's been some really good work being done by the jurisdictions. There's also been some really strong public health advocacy through the Health Food Partnership. It's led to some consultation papers on this in recent years. And earlier this year, food ministers considered issues and advised that regulatory approaches should be complemented by actions undertaken through non-regulatory frameworks. And it's recommended that food ministers refer non-regulatory actions as well. So essentially, it's up in the air what kind of options are being explored. There's non-regulatory options, which are basically the status quo, but there's also potential to regulate the marketing composition and so on to ensure that there's some reach and impact. This sits with FSANZ at the moment. Infant formula marketing is another big one. So Australia's had the MAFE agreement for a while. It's Australia's response to the World Health Organization's International Code of Marketing of Breast milk substitutes. It's nowhere near as strong as that International Code of Marketing. And, in many ways, this allows some really damaging practices which really undermine the promotion of breastfeeding. Of course, infant formula is sometimes necessary, but it's mostly big food companies promising genius kids and liberating women. There's been a review of infant formula marketing Australia report was delivered at late 2023. Government sat on it for a while. And in the meantime, the infant formula industry applied to the ACCC to reauthorize these current voluntary week rules. ACCC knocked this back, and now the Australian government is leading efforts to better regulate infant formula marketing. There's some suggestions that it may be regulated by the food regulatory system. It's still up in the air. That's can be a fraught process, as Adi was alluding to, but we'll watch this space. This is my personal favorite, and many of you will have heard me talk about this at length and tuned out. But the FSANZ Act is the legislation that underpins the operations of FSANZ itself. And you can see here, I put a little excerpt of the Act. The legislated highest priority objective of FSANZ is the protection of public health and safety. And elsewhere, this is described as including long-term health. The food reg system does a really good job at preventing food safety issues, acute health risks. But it does a demonstrably shocking job at preventing diet-related disease, over the longer term. So it's clear that this Act, this Act that underpins the system desperately needs reform to improve public health. So we have this FSANZ Act review. It's been running since 2020. Proposals have really been evolving over time. Some sound positive, but pretty meaningless in effect. Others are clearly negative for public health, and other critical parts are pretty undeveloped. Public health and consumer organisations and representatives have been making really constructive suggestions over the years, ideas about mechanisms and processes that could actually require genuine consideration of long-term health impacts. But the review, to be honest, has continued to totally ignore long-term health issues and really propose changes to make everything even easier for industry. So this involves changes that erode the capacity of the food regulatory system to protect public health and consumers. And this, in essence, means that it'll facilitate more unhealthy foods being brought to market with less oversight, less transparency, less rigor, and less community consultation, which obviously poses risks to our communities. And it also clearly undermines government stated priorities to reduce the burden and cost of chronic diseases. like in essence, SANS is an agency in the health portfolio. This review is being overseen by Commonwealth Department of Health, reporting up to a health minister, but the review is solely for business interests. We don't know exactly what's on the table at the moment. There's negotiations between the Australian and New Zealand governments, and there'll be drafting of legislation. So it's much more of a political process now, which offers, I think, opportunities, but also different kinds of barriers and different ways of working for us as a sector. Look, in essence, there's an opportunity to really steer the ship back into the right course to support public health consumer outcomes. But this has kind of gone begging, it's at the moment, the path is kind of open, and what kind of path will our governments take is a key issue. Will government support a food regulatory system that can address some of the biggest health threats facing our country? Or will they continue on the road to a food regulatory system that incurs great harms and great costs, to individuals, to communities, to governments, to the environment, but set up a food system that's increasingly profitable to industry? Some other things that are happening through the system at the moment, there's updates to the food regulatory system priorities. 3 priorities were agreed in 2017, and these cover food safety, chronic disease, and maintaining a strong and agile food regulation system. I think early last year, we were told there's going to be a new set of priorities. There'll be 4 of them, and the new 4th one will explicitly focus on supporting industry profits. And I think we all in this room know where that may lead us. Some other things that are working their way through the system, trans fats, Australia and New Zealand are really outliers amongst high income countries. Even most low and middle income countries have banned industrially produced trans fats. This can be done really cheaply. It's been found really at no harm to business interests, and it's been really quite effective at reducing cardiovascular disease. Consultation on this was undertaken in 2023. There's no public news on what's happened just yet, but we understand it's still working its way through. There's also work happening on sugar-sweetened beverages. This work has been progressing for a while. There's been a lot happening in the background, I understand, in recent years, but again, no public news just yet. Another newer topic that's popped up is toddler formulas. So special milk drinks for kids aged 1 and over, mostly unnecessary. This has been referred to for SANS recently. Another big one that's kind of on hold at the moment is sports foods, formulated supplementary sports foods, which is tied in a little bit with some caffeine work happening at the moment. And this, again, is sitting with for SANS. So plenty on the agenda. Not all of it can happen in a hurry, unfortunately. But we remain confident that we'll be able to continue engaging in these topics and see some progress happen. Now I think I might pass over to Claire and Lyndall to talk about alcohol.
While you're doing that, Damien, thank you. I know that we ran a little bit over time, so Claire and Lyndall, take your time, but we will aim to, say if you have about 20 minutes, we'll aim to have at least 15 minutes for discussion. And in the meantime, if you have questions that have come up from the food context, do feel free to put things in the chat and we can come back to them when we start answering questions at the end.
Can you see my screen? And can you hear me? Yes,
yes.
Perfect. Thank you. Excellent. Thank you. Yes, my name's Clare Hughes. I manage the nutrition and alcohol unit here at Cancer Council New South Wales. And I also chair Cancer Council's National Nutrition, Alcohol and Physical Activity Committee. And today, myself and my colleague Lyndall Willard-Cole will be walking you through some of the progress and advocacy that's underway in relation to alcohol labelling. Firstly, I just do want to start by acknowledging that I'm presenting today on the land of the Darug people here in the Hills District of Western Sydney, while Lyndall's joining us from the beautiful Central Coast on the land of the Jarkinjung and Guringai people. And we pay our respects to elders past, present and emerging, and any Aboriginal and Torres Strait Islander people joining us today. So we are going to be focusing on 2 aspects of alcohol labelling that are really live issues at the moment with Food Standards Australia and New Zealand and also the Food Ministers meeting. Their proposal P 1049, which relates to carbohydrate and sugar claims on alcohol labels, as well as P 1059, which is around alcohol labelling on, energy labelling on alcoholic beverages. Now, I'm sure I don't need to convince anyone on this call about the harms that are caused by alcohol. It's the cause of risky behaviours, increased risk of suicide, dementia and stroke, cardiovascular effects, fertility and sexual health issues, cirrhosis of the liver, diabetes and weight gain. And of course, from our perspective at Cancer Council, it increases the risk of 7 types of cancer and is estimated to cause more than 500 cancer cases in Australia each year. So alcohol guidelines recommend that we drink no more than 10 standard drinks per week and no more than 4 on any one occasion. And of course, pregnant people and people planning a pregnancy are recommended to completely avoid alcohol, as is anyone under the age of 18. And the less we drink, the lower our risk of alcohol-related harm. And when it comes to cancer risk, there is no safe level that we can recommend. So alcohol is a harmful product, and the way alcohol is labelled and promoted is therefore going to have a significant effect on the attitudes towards alcohol use, alcohol products, people's choice of alcohol products, and that in order to protect people from alcohol-related harm, stronger regulation of labelling is vital. Now, I am going to thank Ali for saving us a few minutes from talking through so well the food regulatory process, and of course that relates when it comes to labelling in particular to alcohol. So we've saved some time there, but I do want to call out a couple of things that are relevant. So you can see there in the purple, there's policy guidelines on nutrition, health and related claims on food products that actually consider alcohol within the definition of food products, but they expressly call out alcohol products as products that could legitimately be excluded from carrying these nutrition and health related claims. And in particular, we're talking about those carbohydrate and sugar claims. Also on the right there in actually it feels like it was that long ago, 2011, the report from the review of food labelling that was led by Dr. Neil Blewett highlighted that there was little rationale for exempting alcohol products from carrying labelling information required on food, and that there was growing evidence that the harms, both short and long term, caused by alcohol use warranted changes to alcohol labelling requirements. And one of the specific recommendations we're seeing already today in those mandatory pregnancy warning labels, and also the recommendation to include energy information on alcohol labels, came from that review. So it has, as you can see from this slide, been a long process to get us where we are today, and certainly work on the nutrition, health and related claim standards probably dates back more than 25 years. But it was the standard was officially introduced in 2013 and fully came into effect in 2016. And also following the Blewett review, ministers had asked FSANZ to prioritise recommendations, including the use of energy information on alcohol products. It's also worth noting that while the nutrition and health related health claim standard actually suggests that alcohol products shouldn't necessarily carry nutrition content claims, alcohol content claims and energy claims were exempt because that information was deemed to be helpful. However, at the time that standard was being developed, carbohydrate claims were already widely used in the market, and so industry successfully made the case that they should remain, and these were also exempt from the nutrition content claim standard that required that alcohol products didn't carry nutrition claims. And also then back in 2017, we saw that food ministers requested that FSANZ review the carbohydrate and sugar claims on alcohol labels, citing their concern that sugar claims could potentially mislead consumers that these products were healthy options. I should also acknowledge that by way of background context, that the position we're in today, the FSANZ did bring together both the consideration of energy information on alcohol labels as well as the work that they're doing on carbohydrate and sugar claims. And both proposals have been through multiple rounds of public and targeted stakeholder consultation, and that FSANZ rightly identified the need to consider to commission consumer information to inform its recommendations for these proposals. And just a quick snapshot of what we might see on alcohol labels. So things that they must show. You can see their standard drink information as well as the alcohol content by volume. Now they're required to carry pregnancy warning labels as well as some declarations around allergens. They can include those limited carbohydrate, energy and gluten claims, and they can voluntarily carry nutrition information panels, and also they don't have to, but they can, or they carry ingredients lists and some energy information. So I'm just going to focus firstly on the energy labelling information before I hand over to Lyndall, who's going to talk about the carbohydrate and sugar claims and the evidence that we're looking at there. So it's certainly the less contentious of the two. So apologies, Lyndall, that you've got the fun one. So you can see on the slide there, the proposed, in black and white, the proposed energy information panel. And you can see there that it is very simple. So it has only the energy as the nutrient, as well as serving information and serving size, and includes the quantity per 100 mils. So it's quite different. You can see there on the right, the full nutrition information panel that some alcohol products do carry. You can see the full protein, fats and carbohydrates and sodium, but also you can see quite a few zeros. So one of our concerns with full nutrition information panels being featured on alcohol products is the fact that it can actually downplay the contribution of not just the kilojoules, but also the alcohol content by creating the impression that they're healthier products. So while we are generally supportive of the inclusion of energy information to support people to identify lower energy choices, we did also raise a number of concerns throughout the process, or just sort of flag that these might be issues. Obviously, when we're presenting alcohol information, we have standard drink information as well. So there is the potential that some of the per 100 ml information or the per serving information may conflict with that information and misrepresent what is an appropriate standard drink or misrepresent what is an appropriate serve size. One of the biggest concerns is that manufacturers can develop the serving size, and this can obviously be, I guess, tweaked in favour of the message that the manufacturers want to receive about the extent to which their product contributes to kilojoule intake. And another thing that's, while it's not depicted there, manufacturers can continue to carry the percent daily intake information, which is a voluntary scheme developed by the food industry that is now able to be used on food labels in particular. But we feel that that is inappropriate to be included on the energy information panel, because we also don't want this information to suggest that there is a particular proportion that is appropriate, that we should be getting energy from alcohol. And it's still an option for alcohol producers to include the full nutrition information panel. So while all these concerns weren't necessarily resolved in the final recommendation, we were largely supportive of the recommendation to include the information overall. And so we understand that this is the recommendation that has gone through to ministers to approve. And now I think I'm ready to hand over to Lyndall to talk about carbohydrate and sugar claims, and I will be doing your slides for you, Lyndall.
Okay. So thanks, Claire, and bear with me while I give you a very whistle-stop tour of all the background behind this one. So we know that food labelling and alcohol labelling can foster people to make healthier choices. So borrowing from the really significant evidence base in food labelling, what we do know is that there is significant evidence that food and beverage labelling is influential in people's choices. Unfortunately, we also know that it can tip the scales the other way and hinder healthier choices, influencing people to choose choices that may be less healthy in their diet. So some examples of labelling elements that can actually assist consumers to make healthier choices include the ones that are listed on the left-hand side there. So we've got the nutrition information panel, the health star rating, and specific to alcohol, we have standard drink labelling and also the pregnancy warning labels. On the right-hand side, though, there are also labels which hinder people's abilities to choose the healthier options. So nutrition content and health claims, so our good old example of the Nutri-Grain high protein, but also this is occurring on alcohols such as the low-carb beers, the percent daily intake labelling, like Clare has just mentioned, but also things like that are called puffery claims such as organic or vegan, and the also insufficient drink-wise pregnancy warning labels, which are now no longer supposed to be shown on labels. So in the context of diet, clear food labelling, like the schemes on the left, actually make consumers, help them to choose healthier foods. It helps them to limit the nutrients of public health concerns that they're eating, and generally avoid more unhealthy foods. But on the flip side, it also helps them choose foods that contain the positive nutrients, things like fibre, and healthier foods generally. It can help consumers reduce their portion sizes. And in the case of health star ratings, it helps them make at-a-glance comparisons to allow them to choose between products. And then we have the very important issue of helping people avoid allergens, which can be very dangerous. So these schemes provide really useful and sometimes crucial information for consumers. Conversely, the labels that are on the right, they are designed to increase product appeal. In effect, they are marketing tools, and they're very successful in this respect. They increase product appeal. They can confuse consumers into believing that the products are healthier than they really are, based generally on these limited nutrients highlighted by the claims. So the really good example of that is a fat-free marshmallow. Still not healthy. And consequently, this makes them potentially misleading. They also stop consumers from seeking out more useful labelling components that might be on the back of the pack, such as ingredients lists, such as the nutrition information, and really concerningly for alcohol, it can also hinder people's ability to recognise the alcohol content. So in the context of such a harmful substance like alcohol, you can see that labelling is particularly important. So alcohol is subject to many rules and regulations, but the product that you consume falls under the Australian New Zealand Food Standards Code. So while there are specific clauses around composition of alcohol, the labelling actually falls under the general food labelling standards. And this is a real problem because alcohol isn't an ordinary food, and there's a much greater risk of harm, both in the short term and the long term of excessive use. So next slide, please, Claire. So you might be thinking, like, what's the big deal about claims on alcohol? So there's a couple of issues that we are concerned about. So Claire has already briefly touched on the energy content, and you can see by this label here, all the zeros in the nutrition information panel give the impression that there's actually nothing in there that's harmful. There's actually research from colleagues at the Cancer Council Victoria that shows that people, and the George Institute shows that people evaluate these products as relatively healthy, as there's nothing in this drink. It's almost like drinking water, so it mustn't be bad for me. However, there's still alcohol there. It's an inherently harmful product, and it can stop consumers from seeking or considering the standard drink information. But more relevant to claims, when a product contains a nutrition content claim, it triggers the requirement for that full nutrition information panel. Not only does the claim potentially mislead, but the requirements of the code actually further could increase that confusion of consumers. So that's the first issue that we have. On the right-hand side of the screen, you can see some more nutrition content claims. So there's contains electrolytes, no added sugar, and an energy claim there in calories. These, aside from the fact that the electrolyte one is actually not permitted at all, it's actually a breach of the Food Standards Code, and this is an actual product that is for sale in Australia. There is evidence that people misinterpret these claims and evaluate the products carrying them as healthier than the products without claims, even though this isn't necessarily the case. And in alcohol, it's definitely not the case because all of the alcohol products are unhealthy. There's also some evidence that people two identical products, one with claims, one without, and people will evaluate the one with claims as lower in alcohol, even when it has exactly the same alcohol content. So that's very dangerous. It's a bit of an unintended consequence. So generally speaking, claims create health halos on products that are fundamentally unhealthy. They're confusing for consumers and may inadvertently encourage people to drink more than they otherwise might. Next slide, please. And this is a very busy table, and I want to say that it's summarising the main pieces of evidence used by FSANZ when making the decision about carbohydrate and sugar claims. So the first two studies were conducted in Victoria from colleagues at the Centre for Behavioural Research in Cancer at Cancer Council Victoria and the University of Melbourne. The third was consumer research conducted by FSANZ itself in response to P1049, and all of them tested the effects of carb and sugar claims on people's perceptions on a range of things. So I don't expect you to read all of this slide, but the main thing I want to draw your attention to is the three big green ticks on the far right side, showing broad agreement between the three studies. All three studies found that people perceive products with these claims as healthier and less harmful to health than products without claims. They also perceive products with claims as lower in energy, more suitable for weight loss, or as part of a healthy diet than products without claims, and generally cause people to make inaccurate assumptions about alcoholic beverages. The only discrepancy between these studies is the interpretation of the findings. While FSANZ concluded that the effect size was small and therefore these findings are not likely to be harmful, modelling by our colleague Ashley Haynes at Cancer Council Victoria found that when extrapolated to the Australian population, over 8.6 million people would be potentially misled if claims on carbohydrates and sugars were permitted on food labels. This hardly seems insignificant in those terms. And next slide, please, Claire. Okay, so what this issue illustrates is that there are several conflicting priorities. As stated by the food ministers, there's a clear need for consumers to be able to access energy information as a way of managing dietary intake and understanding the impact on weight. However, we know that weight isn't the only issue or even close to the most important issue when it comes to alcohol. Despite wanting more information on sugars, consumers are not able to use this information. At best, it confuses them on the overall evaluations of products carrying claims. At worst, it can lead people to believe that products with claims are lower in alcohol than those without them. At the macro level, the policy guideline available supports the provision of energy, but prohibition of claims. Further, the Australian Dietary Guidelines recommend no more than 5% of energy comes from alcohol in the diet and lists alcohol as a discretionary food, so not necessary for a healthy diet. The Australian Alcohol Guidelines also highlights non-dietary harms associated with alcohol use, which we all agree are many and severe. However, these have been entirely left out of FSANZ's evaluation of risks in both proposals. Unfortunately, we've seen this before. As Claire mentioned, carbohydrates on alcohol were not previously permitted on food labels, on alcohol labels, but as shown by this quote, right on the blue box on the right-hand side, and this comes from the P1090 initial assessment report, the Food Standards Code was changed to allow these claims primarily because products were already in market with them, despite strong public health opposition. So as you can appreciate, this seems like a bit of a slippery slope. And as we can already see by the hard coconut water example on my previous slide, other nutrition content claims that are prohibited are already in market. Given this precedent, it's important that these are not permitted to proliferate as a tactic to get them permitted as exceptions in the code in the future. That's all from me, and I'll pass back to Claire.
Thank you, Lyndall. Just touching quickly before we finish up on some of the advocacy that's taken place over the last number of years. Throughout the process, Cancer Council has engaged with a range of public health and consumer organisations through a smaller working group focused on developing agreed positions and responses to both of the proposals, as well as providing evidence to FSANZ to strengthen our arguments that in particular carbohydrate and sugar claims should be prohibited on alcohol products. And you can see there on the right the range of organisations, both in Australia and New Zealand, who have signed on to one of our most recent letters. On multiple occasions, we've written to members of the Food Ministers meeting, the FSANZ board, and also the Food Regulation Standing Committee, outlining our shared concern that the evidence is clear that consumers are misled by these claims, that FSANZ isn't giving appropriate weight to the impact of small effect sizes across the population, that the FSANZ recommendations place the interests of the alcohol industry over and above that of the health of the community, and that FSANZ is not fulfilling its primary objective, particularly to protect public health and safety by continuing to permit these claims. It seems that the contribution of alcohol to weight management is being treated as a greater priority than the contribution of alcohol to broader health and social harms. And given the greater social harm and health harms associated with alcohol use, we argue that greater restrictions for alcohol are needed. And so we've been urging the ministers to request a review of this project. So just quickly, we know that the FSANZ board in March approved both recommendations and that they went to ministers in early April. The intent was that they had 60 days to request a review, which would have taken us up to, I think, early June. They would have had a chance to discuss these proposals at a May 2025 Food Ministers meeting, but given that the federal election was held on May the 3rd, a decision was made to cancel that meeting because there wasn't a clear responsibility within the Commonwealth for which minister would lead on that, and they didn't have adequate support at that time. So what this means for the 60-day rule, we're not entirely sure, but we do understand that food ministers are meeting in July later this year. And so we are again this week writing to food ministers to request that they review that standard. And finally, I know we're sort of pushing the time limit, but just wanted to sort of give an indication of what's next. As I said, we're writing to ministers again. We feel that there's a lot of evidence in the nutrition content claims on foods that haven't been considered. We think they need to consider the market impact of marketing, not just labelling, and also giving greater consideration to policy guidelines, for example, giving priority to protecting public health and the health of the population. So one thing that's coming up sort of in our conversations with FSANZ over this process, particularly in the latter stage, is the thinking that a lack of a policy guideline on alcohol labelling specifically could be giving, I guess, creating problems for their ability to take a stronger stance on alcohol labelling. We're not necessarily convinced that that is the case, but that could be a next step depending on what happens at the ministers' meeting later this month. And finally, health warning labels on alcohol products is one that is sort of bubbling away in the background as well. We know there's been developments in other countries, there's interest in other countries on those things, and certainly it's something that Cancer Council supports as well. So I will finish up there. Thank you, Ali, and also acknowledge those organisations that have led the charge, including the George Institute as well with this advocacy.
Thanks, Claire. Obviously hard for us to keep to time when there's so many things going on, but thank you for such detail on the alcohol proposals. No one's been writing anything in the chat, and I'm not sure if that's actually also linked to the fact that we had cameras and voices off, but if Karen could help by turning people's cameras and mics back on now, I definitely would welcome questions, comments, you know, could be about a specific issue, could be about how to engage with this system better. I'm very interested in different people's perspectives. Okay, apparently you can turn your mic and camera on now manually if you wish to. Right. Well, there's one. Genevieve. Did you have a question, Genevieve? No?
I didn't specifically. I just thought it was nice to put my camera on. Thanks, guys.
Yeah, do welcome cameras. There's a lot of people here, so yeah.
How do you like your chances of getting the ministers to ask for a review? I don't know if there's a question.
Someone from the alcohol team want to answer that? Or...
Oh, look, can we remain ever hopeful? We thought we might have missed the boat. So just the fact that, you know, they are considering, or there is the chance that they will consider it again later this month is giving us hope where we thought it wasn't necessarily going to go anywhere. But having said that, look, we get the impression that there's quite a number of states and territories that are supportive of the issues that we're raising, but really what it's going to require is one minister to take the lead and prepare to open this up again. And Lyndall tells me I'm frozen, but I don't know if I'm frozen for all of you.
We can hear you. I mean, I do think that the steps and the slide that Claire had was quite useful, and just another example of how you really do have to understand all the processes and procedures in the system if you want to advocate effectively, because you need to understand where something's at and who the right people are to talk to if you want a different outcome. Any other questions?
I'll ask a follow-on if no one else has something, but I guess like to that point more generally, because in my mind it's almost like FSANZ is recommending, here's what we think you should do, food ministers. Do they often kind of push back against that and say, oh, well, actually, like, we don't think you've come to the right conclusion? Like, would they generally just rely on FSANZ unless there is kind of strong opposition coming from other groups?
Damien, I saw you nodding. Do you want to comment on that?
Yeah, thanks, Genevieve. There have been occasions in the past where ministers have gone against what FSANZ have put to them. It's happened a few times, particularly with alcohol. The pregnancy warning labels issue got up eventually in the end because one minister was brave enough to go against, well, go with what they knew was right rather than what they were told to do. So that's quite heartening that it has happened. It's happened recently where ministers have directed FSANZ to work on a particular topic where related issues are stalled just to get some things happening where they think it's priority. Yeah, so there is some potential there. It has happened in the past. It's partly an issue of how things are messaged and communicated to ministers as well by not so much by jurisdictions, but by FSANZ as well. So say, for instance, with this sugar and carb claims issue, it's being communicated as simply as clarifying the existing regulation. The existing regulation is perfectly clear. Sugar claims are not currently allowed, but they are proposing that sugar claims be allowed and framing that as simply clarifying what's going on. So there's an issue there where we need to intervene at some different points. It's not simply a matter of putting things before them, but it's about reshaping the narrative back to what is a bit more accurate, let's say.
Other questions? We have 60 people here, so I'm counting on some of you to have questions. You know, people who haven't engaged perhaps in this space but would like to, you know, what is stopping you? Yes, I see Bridget from Vic Health.
Hi, Ali. Less a question and more an update. I just received the FSANZ Health Star Rating Mandate webinar and preparatory work. So I received that by registering for their updates. There's probably a lot of people in this room that are interested in that as well. So just flagging that's just come through. Okay,
that's good. Yeah, so FSANZ, like we said, FSANZ is currently doing the preparatory work. They've been told by food ministers to do preparatory work to prepare for a mandatory health star. It's the scope of that work is sort of ever evolving. So yes, if you're interested in that, it would be good to attend FSANZ's webinar on the topic.
So this webinar that's coming up seems to be solely about the products that are within scope of the policy moving forward, which is also slightly concerning. I
think that this is one of the issues when you have something that's voluntary and it goes to mandatory. It's, for example, deciding where a product is a product that's intended to carry health stars versus allowed to carry health stars, and the regulation will have to be much watertight on that as the system comes in.
Yeah, only had that in place since 2013.
And well, you know, we in the voluntary system we haven't really had much enforcement activity going on, but obviously the state and territories who will most likely, or under the current FSANZ Act, would have responsibility for enforcing it, would need to have very clear guidance on what would be a breach or not. Anyone else? We have 5 more minutes. Other questions from my panel? Claire's frozen again. I think it's interesting the the example of infant formula. So having been in some recent discussions around that, that is one where I would say this question comes up of, is the food regulatory system the right place for this policy issue? And, you know, it might be the right place for a labelling change for infant formula or something around marketing, but many elements of the international code that we're trying to get better implemented in Australia relate to things that wouldn't traditionally be in the food regulatory system. And so if we simply send this matter to the food regulatory system, it's likely to limit the scope of legislation that we would be put in place to improve the MAFE. And that is a reason why currently there are some advocacy groups that are asking for this issue to stay more under health-led legislation and not go into the food reg pipeline. And Monica, did I see your hand? No, just your camera. Hi. Yeah, I think because there is so much happening in the food reg system, there is a temptation to be like, oh, that's where to put something to get it moving. But because the pipeline is now so full, we also do really have to prioritise what we want to get progress there rather than continually putting more in, I think. Genevieve.
I mean, on that point, how do some things end up with like the ACCC, like country of origin labelling? If that's about labelling, how does that end up in that pathway versus in the food reg system?
It's a very good question. I think it used to be in the Food Standards Code. I think that one reason why country of origin came out of that was that it doesn't only apply to food. So country of origin labelling is on other products as well, and the legislation there does apply to other products. I think things like cut flowers and things is one reason, but I also think it's probably political decisions at the time and maybe willingness of someone else or interest of another group to take it on. You might remember when we've had mandatory country of origin for quite a long time, but when we got the new one fairly recently, it was after the berry scare. You might remember that people got hepatitis after eating berries. And this really created like a political window of opportunity to do something. And a change was made very fast. And it's another great example of which shows that rapid and widespread labelling change is totally possible if required by law, because 2 years after the country of origin label came in, you know, we've done research to show that 93% of products had put it on. Whereas in that same time period, we still have less than 40% putting health stars on. So they have updated their packages, but they have not put on a health star rating at the same time. So it's not just about, obviously not just the cost of a labelling update, it's about your will and whether you're required to do something. And, you know, that is why I think we're hopeful for a mandatory health star rating. Claire, hand up but frozen, but...
Sorry, I can hear you. I was just also thinking back to the Blewett review again that did almost set up this hierarchy of the aspects of the Food Standards Code that applied to health and the aspects that were, and it's not necessarily the right term, but consumer values. So, you know, FSANZ did have responsibility for country of origin labelling back at the time of the Blewett review. So I'm not solely blaming the Blewett review, but I think that distinction and where they're sort of making a case that it's more around a consumer value than, you know, required information to make an informed choice. Having said that, you know, yes, prevention of public health and safety is should be the top priority of the food regulatory system, but also FSANZ have a responsibility to provide information to make an informed choice and to prevent misleading and deceptive conduct. So I would argue that it's not solely a reason to get something out of the Food Standards Code just because it's deemed to be about consumer value.
Thanks, Claire. Last opportunity, we're at 3 o'clock now, so I don't need to drum up any more questions, but if anyone has any burning questions, or you can write them in the chat. But yeah, I'd just like to thank everyone. We had really good attendance today. I'm sorry I couldn't see many of you for most of it. I hope that it was useful for you. If you are interested in like joining advocacy in this system, please feel free to reach out to myself or Damien or anyone on the webinar today, and we'd working in this space all the time and keen to build the capacity of other people to help influence outcomes as well. Thank you very much.